Okay, so in this session, I'll be taking a recall of orthopedics, and just to remind that it's just like the 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 questions are being given in fragments, so we don't have a proper stem of the questions, and also I don't have the exact options as such. So whatever little information I could gather in such a short span of time, I have presented a basic matter, and hopefully that will solve the purpose, right? So, and if I'm wrong anywhere, please correct me. If you want to do any sort of correction, please let me know. So you are always welcome in that. So the very first question was about like a child who is having bowing of legs. So based on these different features, the clinical diagnosis was asked, right? So child with bowing of legs, and again in the x-ray we can see the classical genu varum deformity. Clear? So this is the genu varum deformity here, and serum calcium is also less. Okay, great, thank you. So thank you, Bhavnesh. We can add increased serum alkaline phosphatase. Clear? So okay, I'll just add this statement also. And I think the moment you have a child with genu varum, there is no need to go towards anything else. Straight away you can go for the diagnosis of rickets. Clear? So I think this was a very common question which is repeated over the years. Yes, the presentation can be different, but the question was from the important topic, and I feel most of you must have marked it right. So this was about rickets. Clear? Any addition to this? If anyone want to add something, or want to correct me in the question statement, or good evening Imran, good evening Bhavnesh. So I think this question was one of the simplest one we can ever expect, and always we tell that like rickets is a very important structure, as well as like in the case of pediatric orthopedics, right? So this is rickets. Now the another question was extremely easy. I think no one can mark it wrong, even like in subconscious state of mind, and this is sun ray appearance, and again this is osteosarcoma. Clear? So this is osteosarcoma, and I think most of you must be knowing what actually is sun ray appearance. So suppose if this is the bone, there is calcification along the blood vessels or the Sharpie's fiber, and that what give rise to the sun ray appearance, something like this. Clear? So this is sun ray appearance, and in one of the sessions it was asked like why it is seen. So this is actually the calcification, and this can be along the blood vessels, or some book says Sharpie's fibers. So this is the concept of the sun ray appearance, which is seen in osteosarcoma. Okay, so I think this everyone should have marked it correct. Now the third question is about a splint, and usually they ask about Thomas splint, the knuckle splint or cock-up splint, but this time they have given you a splint of the lower limb. So what you can see here, this is the splint here. Clear? So this is the splint, and this is for immobilization of the lower limb. So this actually is Thomas splint, and this we usually use for fractures of proximal femur. So immobilization or splinting for fractures of proximal femur, it can be say neck of femur or intertrochanteric femur, and this is the use for immobilization till we do definitive surgical procedure. Initially when it was used, the initial or the historical use was for TB of knee. Clear? So this is the Thomas splint, and if we look at a picture of Thomas splint, it is there is one ring like this, then there are two bars like this. Okay, so this is the inner bar and this is the outer bar. Now in outer bar it's very easy for us to say which one is outer bar, because it has got a slight deviation or slight bending here, and this is to accommodate greater trochanter. Clear? So this is the Thomas splint for lower limb injuries, especially around the hip joint or the proximal femur. Then there was one question which was actually not from orthopedics as such, but it was based on anatomical concept, and I was being told like that was a X-ray of the lower limb and there was a pointer, and the question was about like which type of epiphysis is shown in the image. So see, like when we discuss epiphysis, we usually discuss four types. One is the atavistic, then second is the traction. Clear? The third one is pressure epiphysis, and the fourth one is aberrant epiphysis. Clear? So this one which is shown here is actually os trigonum, right? So this is os trigonum, and this is an example of atavistic epiphysis. Clear? So this is an example of atavistic epiphysis. So if this is the image, pointer is in somewhere around the talus, then the answer has to be atavistic epiphysis. Clear? Then moving forward, there was two questions from peripheral nerve injuries. One was about like tingling in thumb, middle finger and index finger. So the moment you have this kind of presentation, like if suppose this is thumb, this is index, this is middle, then this is ring finger and this is little finger. So if you have any presentation like this, and this is actually on volar aspect, this is 3.5. Clear? So this all is the territory of median nerve. So if the patient is having any problem in the lateral 3.5, like we go from like lateral to medial. Clear? So this is lateral, this is medial, of course. So if lateral 3.5 is all territory of median nerve, I think most of you must be already knowing this, and I am very sure you might have done it right as well. So this is on volar aspect, not on the dorsal. Volar aspect of, or you can say the palmar aspect. Clear? So 3.5, this is all median nerve compression, and I think if you can remember the carpal tunnel syndrome. Clear? So this is a classical case, and I think the moment you find this thumb, index finger, middle finger, obviously the answer has to be compression of median nerve, right? And needless to say, the remaining 1.5 is all territory of ulnar nerve. Clear? So this is, I think it has been taught to you since years, right? So this is median of compression. Then there was one question about clawing of fingers. Now I couldn't have the exact question, because if you say clawing of fingers, then if there is nothing specific, then the answer has to be both median nerve plus ulnar nerve, right? Because clawing, it might suggest complete clawing. And if the question was about partial clawing, then obviously you can go for ulnar nerve. So I am not very sure about what the exact statement of the question was. If it is complete, go with both the nerves. If it is partial, choose only ulnar nerve. Now partial means there is clawing of the fourth and the fifth finger. Clear? And actually, what is the concept why we are having this partial or complete clawing? Because the clawing occurs because of paralysis of the muscles, the small muscles which are known as lumbricals. And the fact that the lumbrical 1 and 2 has a different nerve supply and 3 and 4 have a different nerve supply, creates this all picture. 1 and 2 is supplied by median nerve and 3 and 4 is supplied by ulnar nerve. Clear? And if you know, the counting is done from lateral to medial. So this is lateral and this is medial. So this medial goes to 4th and 5th finger. Clear? So therefore, if the word is complete, it means all the 4 will be paralyzed. Then again the answer has to be median plus ulnar. And if the question is about partial, in partial only 3rd and 4th will be paralyzed, and therefore the answer will be ulnar nerve. Clear? So this is the basic concept of clawing of fingers. One has to completely read the statement properly, understand the statement properly before jumping on to the answer. Right? So this is in short about the orthopedics part.